Hello, we are the Doctors Bjorkman. I'm Sarah. I'm a board-certified OBGYN and first-time mom.
I'm Kurt. I'm a board-certified pediatrician.
And this week we're going to do something a little different. We have poured ourselves a glass of wine, and we are going to do a Doctors React to one of my favorite shows.
And one of my least favorite things in the world.
Selling Sunset, Christine's birth story. Let's get into it right now.
Trying not to step in the dirt.
Yeah, I know, me too.
The last time I walked on one of these, my heel got stuck in the wood. Like I kept going and my shoes Hello.
Ready right now. Hi, guys.
So we had balloons at our house,
We
but I
did.
think that's about the only thing that matched this. Like,
Right?
definitely weren't getting visitors yet. I mean,
No.
visitors is absolutely a personal decision.
Yep.
But when you're ready for that, the one thing I will say is avoiding large crowds, trying to keep baby healthy, lots of hand washing for whoever's going to hold baby.
Yeah.
Close friends and families are okay. Making sure people have flu vaccine, vaccinated for pertussis, whooping cough are the biggest things
Yep.
to keep babies safe in this age group.
Yes.
Hi, guys.
Hi.
I'm so happy to see you guys.
Oh, I'm so happy to be here. Oh my gosh, I forget how tiny they are. Look how tiny you are too.
Yeah, Aw, you're so sweet. I was doing Pilates and yoga, standing on my head doing inversions up until I pretty much gave birth. So I was doing my best to just, stay in shape.
Gotta love that. Yes, Christine, talking about exercise in pregnancy and being fit.
Yeah, we did a video about this about a year ago, all about exercise and pregnancy being one of the best things you can do for you and baby during pregnancy.
Yeah, but there's sometimes this myth that you shouldn't exercise or you can't, and so love seeing a celebrity talking about the importance of fitness.
Be healthy. And then I was like, I'll get liposuction after if I need to.
Wow. He's so little.
We're all human.
Hi. Say hi.
Oh my God, you look beautiful.
So good to see you guys.
Talking about looking great, look at you.
I'm so tired.
There is the first thing I really relate to. I am so tired.
It's so weird seeing you with a baby.
I know, right? Isn't that crazy? I've officially been a mom for a few days, and I'm surprisingly feeling
I've officially been a mom for a few days. Let's talk about realistic expectations for a postpartum mom 3 days out. This is not
Had you
it.
showered by then?
Yeah, unclear. I feel like at the 3-day mark, I had silverettes taped to my nipples. I was wearing gray sweatpants around the house. We hadn't slept much, and we were just trying to get the baby to latch or sleep or stop crying.
Yeah, 2 weeks in, we were like, I went to work and came home and you were dehydrated and malnourished. So this is not the normal to be
is
this
not-
put together.
This is not
time.
normal, but
Props to her.
yeah.
I'm surprisingly feeling good. The baby's doing amazing. He's a perfect little angel, and I couldn't be happier.
Perfect angel. I'm so happy for you.
So, what's been going on at the office?
Yeah, I mean, it's been nice. Jason organized this group dinner that we're going to have, and I'm super excited because it's like my first dinner. It's going to be fun.
I wonder how that's gonna go. Every time there's a dinner party, there's always some drama. I wish I could come, but let me know how that goes.
We'll report back. Yeah. So how did it go? How was it? The everything?
Oh my gosh. So I'm
So we are really going to get into the birth story right now.
laying in bed, and I'm turn over to my side, and it was like a Cirque du Soleil performance water balloon boost through my vagina. I was like, what is this?
Oh my God.
And I stood up and I was like, oh my God, my water just broke.
my God.
So there is a real life description of what it feels like to have your water break. It can be this sudden, spontaneous thing. You're laying in bed, you are, out and about doing things. It can be a little startling.
Either with contractions or sometimes even before.
Yeah, it doesn't sound like she was
contractions
in labor when this happened. Kind of just that kicked it off for her.
I was 9 centimeters dilated the second I walked into the room.
Oh my God.
And then they're like,
So first time mom wouldn't say that is typical to have your water break and boom, get to the hospital and be 9 centimeters. That is not the usual.
Usually a bit longer, a bit more work.
Yeah, but everybody's different.
no, 10, we gotta go.
That's when you
She's
push.
full dilated. And I just see my legs flying in the air. And then he was coming out sideways and his umbilical cord was wrapped around him.
So at this point, the first time I'm watching this, I'm just like, Christine is a little extra and certainly has a flair for the dramatic. You know, legs flying everywhere, 10 centimeters. When a patient shows up to the labor floor fully dilated, it can be a little bit wild. You're just like, somebody get gloves on. We need to catch this baby. So definitely she describes a little bit of chaos, and that's understandable. Babies don't come out sideways.
But the cord could potentially be an issue.
And that can cause some heart rate dipping. And so I'm still with her here.
So
Was the baby in
yeah,
distress?
they said his heart rate's going down. All I hear is emergency C-section, let's go, let's go, let's go, let's go, with no epidural.
Oh my God.
So there always is generally some kind of pain control for a C-section of any kind. Just so
They did it without.
Poor Christian was probably fervent.
some kind of
He was absolutely freaking out. And then when we were doing the emergency C-section, my heart rate was going down. The baby's heart rate was going down.
Oh my.
And then one of the nurses went up to Christian and was like, you need to make a priority right now. You have to choose one.
Shut up.
He was like, both. It's like both.
Wow.
So I'm an OBGYN. That would absolutely never, ever happen. I would never say you have to choose mom or baby. There is, like, in this situation, never in a million years. You are going to...
Taking care of mom takes care of baby.
Correct.
Taking care of baby takes care of mom.
Yep. Like, this is... that...
The answer is always both.
Right. Of course it's always both. So that's a little bit flair for the dramatic here.
I just remember before I went under the anesthesia, hearing that the baby's heart rate was going down and they were afraid it was going to stop. That's the last thing I heard. Until I woke up. So it was...
So, and then she said, you know, I've been kind of rolling my eyes at some of this, but then Christine said, and then I woke up. And right there, I knew that, yes, she absolutely had a C-section. It was an emergency, because if she was waking up, that means she had general anesthesia, where they intubated her, they put her to sleep, and she actually woke up. And the only time that is going to happen for a C-section, if it is a real emergency. For a C-section, we usually like to do a spinal or an epidural. We talked about different pain management options for labor. But general anesthesia for a C-section sucks because mom is asleep and we want you to be awake. We want you to meet your baby. We want to do skin to skin as soon as that little babe is out. And so this right here said it was wild. Baby's heart rate was dropping. It was a true emergency.
Which is why it's so good that you guys are so good at getting the baby out safely so fast.
Yep. So,
Like a minute, 2 minutes.
Yeah, in an emergency, your OBGYN can get that baby out in 60 seconds. So, poor Christine.
It's a nightmare.
Yeah,
It's literally a nightmare. Are you hungry? I'm just gonna go feed him really quick.
So, something to think about here.
Babies are really needy. It is totally normal for them to need to eat often. If you have a new baby, they need to eat often. If they are fussing, feed them. This could be every 30 minutes, every hour. Cluster feeding is a normal thing.
Yes.
This is baby getting the feed they need to grow and to help your milk come in, or if they're formula fed, just helping them grow as their stomachs start to expand and get used to frequent feeds.
Yeah.
Then I'll be right back.
Okay.
Are you hungry? Here, come here.
Shit, I need a drink. That stressed me out.
Okay, I'm gonna open the bottle of
Wait, did I say I wanted to have another baby one day? I just changed my mind.
Wow.
I guess we're thankful to say that, you know, all three of us were able to come home from the hospital, and we're just counting our blessings each and every day.
So, shout out right here to all the OBGYNs out there who are taking amazing care of moms and babies. As an OBGYN, you always have two patients that you are responsible for, mom and baby, and OBs are out there saving lives every day. So cheers.
This is also
to you.
kind of goes to the point of why it's so important to have your baby born in a place that's going to be safe if things go awry.
Yes.
Women have been giving birth in fields and outside of hospitals for thousands of years, but dangerous things like this happen and can cost the life of a baby or a mom potentially.
Yeah.
Are you sleeping now?
I'm in shock with your story.
Yeah, it was insanity. I wake up and I just remember someone with a needle that was this long performing a tap block on my abdomen.
What's that mean?
I guess it's for the pain.
Yeah. So a tap block, TAP, transversus abdominis plane, and it is a long needle. You inject kind of a numbing medicine for a nerve block to kind of block those pain signals from that C-section
and that
incision.
gives pain coverage for kind of the next 18, 24 hours after that C-section for mom in that recovery phase.
And that was really a great move by her anesthesia team, because that's one of the other kind of bummer things about general anesthesia is moms can be in a lot more pain because they don't have that epidural or that spinal that has this long lasting kind of pain coverage. So doing a tap block was a really great move by the anesthesia team.
Oh.
But I'm like, what is going on?
You hadn't
Like, I
even at
couldn't
this time
no,
held the
I couldn't
baby.
even hold my baby. Like, I couldn't hold him.
And this just goes to, like, sometimes babies are sick, sometimes babies need to go to the neonatal ICU unit. They need to go get that extra care, which is so tough for parents and even on baby too, to not have some of that valuable skin-to-skin bonding period. But in this case, it was for the benefit of that baby to make sure that they were going to be safe.
Yeah.
Because I couldn't, you know? It's like, this is a nightmare for any mom. Are you kidding me? Life is so short, and you never.
I mean, this is a nightmare. You know, it sounds like everything happened really fast. You know, her water broke. She came to the hospital. She was 10 centimeters. She tried to push. Baby's heart dropped. The next thing she knows, she's being put to sleep, and she wakes up and she can't. Her baby's not there, and she hasn't held her baby. And like, this is awful. And I think there is a lot of birth trauma that doesn't get talked about and doesn't get healed from. And it's really important, if you have something happen like this, that you debrief with your OBGYN and your partner is involved, and the people who are there we talk to them and you work on processing that, because
even like her partner having been asked, like, choose mom or baby, with the trauma of that situation, both for mom and partner, is something that is good to debrief as a team, and then also with your medical provider. Can't imagine going through that.
This
short, and you never know like what tomorrow brings. And so I was just like, I'm not gonna worry about dumb shit anymore.
Well, you will have to watch the rest of the season to find out if that is true. But so that was Christine's birth story. Sounds like it was a wild ride. I know I certainly enjoyed watching it. Kurt?
I won't catch the next episode, I promise.
We hope you enjoyed this Dr. Reacts. If you have any requests of episodes you'd like us to do, please leave them in the comments below. We'll see you next week.
Bye, guys.
We're doctors.
But not your doctors.
Anything we've said in this video is for education or entertainment purposes only.
It is not medical advice.
Any specific medical questions you have should be directed to your provider.